Hey everyone, I'm Marianne Pizzatola, and many of you do know me, but there's a lot of you that don't. I am retired from New York City Fire Department Emergency Medical Service. I am doing this video today to educate the active employees, the active union members, those in local 3621 and 2507 that may not know exactly who we are, what we're doing, and what is happening to us today that is going to affect you very soon, and some of you sooner than I guess you thought it would. I was a union delegate. I was very active in my local. I was a pension and benefit consultant. I helped people with their retirements. I helped people file their pension papers. After 9/11, I retired, and when I had gone to the District Council 37 for assistance, for pension, I found the system completely useless. Their pension and benefit people never responded back to us. And I ended up learning the system and became a pension and benefit consultant after perfecting the process in order to be able to help myself retire and those of my friends that were struggling with the same process. As back in the day, the union opinion was, we got you the legislation to get you your 3/4 disability pension. It's up to you to get it on your own, which was a very difficult process, as I'm sure many of you who are going through that process or hear the stories of NYCers will understand. So fast forward, when I went to the district council and I wasn't getting that kind of help, I had then went to DC 37 Retirees Association, and basically the then president said to me of the District Council 37 Retirees Association, hey, your benefits are so different than us retirees in district council, mostly civilian, go start your own retirees association. So I did that too. So I am president of the FDNY EMS Retirees Association, and we have an amazing team that runs this association and helps us. Our dues are $30 a year. They've been that way for over 20 years. We hold meetings or weekly Zoom chats, in light of COVID, because we're not getting near each other. Since most of us are disabled or immunocompromised, eventually we'll be able to get together again and do a luncheon or a holiday event, but that's not going to happen now. On top of that, this past year, May, June, we were given information that the unions had been negotiating to take away the Medicare benefits of a retired person. Now, I don't know what you guys know, but us, we were promised that when you retire, you get to keep your benefits for your lifetime. And actually, almost all of our summary plan descriptions all say that the benefits that you have in employment carry with you into retirement until your death, end quote. That's actually the language. So I'm here to tell you today exactly what happened and how you are a part of this and you don't even know it. So what is a union, right? A union is a labor organization that represents you in collective bargaining. That's all they're really able to do, represent you in collective bargaining. A union, in public employee union, can represent you if you have wages, hours, and work conditions. You have that, we don't. I don't earn a wage, I don't have work hours, and I don't have work conditions. I am retired. So a union cannot represent me. You have another organization that all of the unions in New York City are a part of. It's called the Municipal Labor Committee. There's 102 unions that fall under the auspice of the Municipal Labor Committee. What is the MLC? Well, the MLC is another umbrella organization of all of these unions to collectively bargain for active union members, employees, for citywide agreements. That's where your citywide agreement comes from. They don't represent us either. Although they want to think they do, but they really don't. Again, they don't. Mr. Nespoli, who's the chair of the MLC, he's also president of the Sanitation Workers Union. He's been saying several times that he represents retirees through our unions. That's false too. So how did this all start? It's actually started in 2014 between the United Federation of Teachers, UFT, and the MLC and the city OLR. The teachers hadn't had a union contract, and it had been many years, and they were negotiating with labor relations in order to get a contract. The city said to them, hey, you want this big raise that covers like 10 years. Would you do us a favor and talk to the MLC and try to get them to agree to healthcare savings? So Mr. Mulgrew then said, yeah, okay, no problem, give me my raises. So we did. They made an agreement. They got their raises. I forget what it was, 10%, 14%. It was a nice chunk of change, but it was for a large period of time. He then went to the MLC, he's like a VP on the board of, and said, hey, we need to get some healthcare savings, chop. Let's get this done. And they did. They agreed to healthcare savings, which isn't a bad thing. Okay, don't get me wrong. How they did it is the bad thing. The city and the Municipal Labor Committee came up with 8 different ideas on where they could save money in healthcare costs. And they weren't limited to those 8. They were just 8 that they came up with in the meeting. And over the course of 14 and 18, they actually realized a great deal of savings that went into a fund called the Health Insurance Stabilization Fund. This fund, Health Insurance Stabilization Fund, was designed to stabilize health insurance premiums so that as their costs rose, that there was a way to pay for them. Unfortunately, the union and the city tapped this fund for employee raises for you, and you probably didn't know that. If they made agreements that if the fund reached a certain benchmark, like $364 million, I believe it was, in excess of what the benchmark was, that the unions could take that money and distribute it amongst each other how the city and the unions agreed, and they did. And today that fund is bankrupt, and that fund pays for our health insurance. So in the infinite wisdom of the Municipal Labor Committee, who all of your unions has a representative on, came up with this idea to transfer every New York City retiree from their current GHI emblem health plan, who's Medicare eligible. So it would be, you're Medicare eligible, you have your Medicare as your primary insurance, they cover your first 80% of your bills. And then the last 20% is covered by your city health plan, which most of us, it's GHI emblem health, or GHI senior care is what they call it. And that pays your last 20%. We didn't pay for that plan. It was a free plan. It's been a free plan forever, 40 years, I guess. If you bought the catastrophic rider, it was like $1 a month. It was no big deal. So it didn't really pinch you. You also are entitled to Medicare B reimbursement. So you pay $148 a month. I think now it's going up to $170 something a month for Medicare. But by the end of the year, Labor Relations reimburses you your Medicare B reimbursement. And that's a city rule that they give you back, right? And that's for you and your family. So fast forward, come July 14th, we learn of a secret vote being held by the Municipal Labor Committee and the District Council and all these unions, that they were voting to proceed to push current retirees into a Medicare Advantage plan. What is a Medicare Advantage plan? Well, it would take every Medicare eligible retiree off their current traditional Medicare that you pay Medicare for, and your Medigap plan that you get through New York City, and force you into a Medicare Advantage plan. Medicare Advantage plans are run by for-profit insurance companies, meaning that they make money, unlike Medicare, to prevent you from getting the care that you're used to getting. So what do they come with? They come with prior authorizations, where we never had that before. You have had it as an active employee in your plan, prior authorizations for treatment. As a retiree, Medicare doesn't require prior authorizations on the front end. It happens on the back end. The city likes to say, oh, well, you have Medicare Advantage. We're better because we have prior authorizations on the front end. Well, no, because now you're delaying our care for like 14 days or more. And sometimes you can't wait for that care. Traditional Medicare, there is built-in authorizations. They're on the back end. The physician handles everything, just like in Medicare Advantage. But on the back end, even if that authorization was denied, it's the provider that gets stuck with the bill, not the beneficiary. In this other situation, it's completely different. And then you're usually left with a higher coinsurance paying more money than you would expect. The city and the MLC also imposed this year for the very first time copays. Retirees never paid copays. We do now. We're going to pay them in the GHI senior care plan, and we are going to pay them in the Medicare Advantage plan. The unions then started touting all of these benefits. Oh, but you have access to these accessorides, and they'll take you to your doctor's appointments, and you get a Fitbit, and if you get out of the hospital, we'll have meals delivered to your home. You know, it sounded all great, but it's like watching propaganda on TV, like Jimmy Walker or whatever. The rides are accessorides. You have to call at least 48 hours in advance to schedule them. And you and I both know, being in emergency medical services, we've seen these vehicles all the time. Not only do you have to call in advance for them, you may be waiting more than an hour or 2 or 3 or 4 for the ride home. Not worth it to me. And they only do a certain circumference, and they're not available in every geographic area. So if your doctor is more than 30 miles away, guess what? You may not be able to get that ride. Silver Sneakers Gym. I'm sorry, I don't really feel like going to exercise in a gym during a pandemic. And I would not definitely be exercising in a senior citizen class either. There's a lot of perks that are described that are not necessarily perks. And maybe they're perks for some people, but they're not going to be a perk for everybody, okay? The meals, they'll only deliver to you when you're discharged from the hospital if you have a certain body weight and a certain A1C. If that's not you, guess what? It's not a benefit for you. So all these things that they want to say, well, look what we gave them. We gave them all these things. Oh, and we're going to give you a Fitbit. No, I don't need a Fitbit. I got a smartwatch. I have a smartphone. I don't need that. So this is the frustrating thing, is they're trying to sell you something that isn't a benefit for you, right? Like selling ice to an Eskimo. You don't really need it. Besides, we were trained for decades by DC 37, Lillian Roberts, to never privatize your healthcare, never do a Medicare Advantage plan. But yet, the unions actually did it to us this time. And how did this happen? Well, as a retiree, I can't vote for your union officers. I'm not allowed to. I can't file a grievance when I didn't like something that happened in a collective bargaining agreement, like this plan. I can't do anything to challenge this except file a lawsuit. And that's what we did. This is a broken promise. And how did it get passed? Each and every one of you voted for it. How did that happen? Well, this past year, the unions ratified, almost every city union ratified a contract. And if you go back to 2014, much of the same language was in those agreements as well. If you look in the last contracts that were signed, that you will ratify, it actually has language referring you back to a 2014 or a 2018 agreement. You were told by your unions you had no givebacks, but actually the giveback was us. So when you voted for these contracts, you actually supported them meaning your union officers, your unions, imposing a health cost savings on the backs of retirees that built your unions and advanced your agencies. And those would be all your city unions, including EMS, fire, police, correction, sanitation, NYPD, PBA, all of you. DC 37, UFT, everybody. Every single union. This left many of us in a very bad situation. And let me explain why. You didn't know that you voted for this. And I know you didn't, because when I'm reaching out to still my friends that are on the job, they didn't know anything about it. And because you're not Medicare eligible, and Medicare for you is something that's so far off into the distant future, maybe you don't understand the program, maybe you don't understand what it costs, maybe you don't understand the difference between Medicare Advantage and traditional Medicare. But I'm going to tell you that there are big differences. We work very hard when in our careers. Many of us are 9/11 responders out on disability. Many of us are on disability, injured from our agencies that are not first responders. Many of us are widows or widowers whose spouses died in the line of duty. And this affects each and every one of us. You've read our articles in the newspaper. You've seen it in the Daily News, the New York Times. You've seen it in the New York Post, the New York Focus. You've heard about us. And it's real. The information you're getting from DC 37, the UFT, the MLC, they're all telling you this is a great plan and we're a bunch of complainers. The MLC put out a letter calling us rumps, rump retiree group, or the so-called retiree group. The MLC just put out another email today. I'm sorry, this was the 24th. That said, the spreading of misinformation by the new plan's opponents has got to stop. Our retirees are getting hurt. No, Mr. Mulgrew, this is actually you that did this. It was your arrangement with OLR. It was your arrangement with the MLC. You convincing the MLC to do this, and every one of the unions under the MLC umbrella that followed. Our retirees gave up years of 0-0 contracts so that we could preserve benefits that we were entitled to, that you all of a sudden felt it was okay to negotiate away. A benefit and a contract that we can't vote on, and we had no say. So August came, the vote was July 14th. By August 13th, we convened an organization meeting to try to get up and build an organization to fight this. Saturday, August 15th, we started our Facebook page. By August 17th, we filed our incorporating documents with the state of New York. By the 19th, we started a PayPal fundraising platform, and we were live by the 18th, 19th, 20th. Today, we have over 13,000 people on our Facebook page. We have another 5,000 people on our website email list. And that grows every day. And our Facebook page grows about 1,000 people a week. We have a group that circulates emails or phone calls to retirees who are not computer savvy, who are not on social media, who are not on Facebook and don't do email. We have retirees in their 80s, 90s, and 100s who don't even have an email address or a smartphone or internet. So now think about how it would be for a retired person to understand that their city, former employer, and their former unions are imposing a new insurance plan that they have to find out if their doctors are in, that the unions keep saying that they are, but they're really not. Well, we'll call our doctors and they'll say, I'm sorry, I'm not taking that plan. Or I know that they say I'm taking it, but I'm not. Or I'm sorry, if you go into that plan, I won't be taking patients in that plan, I'm sorry. Or we're given a website tool by Emblem, Empire, Blue Cross Blue Shield, called a Find Care tool to look up our physicians, and every single one of them, well, most of them, will show up that they're in there, some don't. But then when we go to the doctor and say, hey, this says that you're in here because you're in this network, are you gonna take this? And they're like, no, we're not taking a Medicare Advantage plan. I don't care if it's a custom plan, I don't care if it's a New York City plan, we're not taking the plan. So now you're sick, 80s, 90s, 100s, and now you have to find a new doctor that will take this new plan. Shouldn't be doing that to us. We have retirees who are in their 80s. I have a police officer who is in his 80s, who retired in the 70s. A police officer's salary in the 70s was $15,000 on average. He retired on an ordinary disability, non-service connected. Typically, it's a 1/3 pension, taxable. Although he's in the state of Florida, he's not paying income tax, but it's a 1/3 pension. He's on Medicare. His wife's on Medicare. He has an adult daughter who's on Medicare. If they all chose to stay in their GHI senior care plan and keep their traditional Medicare, each of them would be paying $170-something a month for their Medicare plan, which is reimbursable by OLR at the end of the year. But then they would be paying $194 and change each times 3 in order to keep their GHI senior care. Because the daughter is in a residential facility, she's also on Medicaid and has a private prescription plan, Medicare Part D plan. If she's forced into a Medicare Advantage plan, she's not allowed to have the Medicaid or the private Part D plan. The facility doesn't take Medicare Advantage, so they have no choice but to opt out, meaning they have to stay in, not go into they cannot go into the Medicare Advantage plan. What does that mean? Well, by removing his daughter, because he can't afford the $200 a month for all of them, by removing his daughter from his city health plan, he is now no longer entitled to his Medicare B reimbursement. So he will now be paying out of pocket for her Medicare. How do you do this? How do you tell a retiree that this is what's now going to happen to you in your 80s? And by that point, you have made life decisions based upon what you knew to have for all of these years that now is going to bankrupt your family. That's not how unions used to work. Unions used to protect their retirees. They don't do that anymore, clearly. So I was asked to do this video because the person I spoke to today, he didn't know that this happened. And he didn't understand why I was complaining. He didn't understand what was so horrible about Medicare Advantage plan and why this was bad, because they knew that they were getting cost savings from it. In the contracts between the MLC, between the Labor Relations and the UFT, it even says, and this is probably part of most of your contracts as well, that if the healthcare cost savings are not realized, because they should have been in effect in January. Actually, I think they're supposed to be effective in October, November, which is $50 million savings a year for the next 5 years. If those savings are not realized, the unions have to pay back what they got from the city. I guess a percentage of it. I'm not really sure on all the details. You'd have to ask Mr. Mulgrew about that. But this is a major ugly. And you need to ask your unions about this, and you need to push hard. And then come back to us if you're not getting the straight answer, because we'll give you all the documents. We have them all. Trust me when I tell you, we were loyal union members. There are some unions that still have their retirees pay a portion of their union dues and gives them certain benefits. A health insurance plan, a member card, a pen, I don't get any of that. I voluntarily had been paying my DC 37 retirees dues. I get a public employee press paper just like you do, if you're a DC 37. That's really the only benefit I get. And to me, if my district council is okay with selling me out and throwing me under the bus, I don't need another union newspaper where 3/4 or 99% of the paper is all about active union stuff, and the very last page is about retiree stuff. It's important to me. Morals, ethics, compassion, that's what's important to me. So you as a union member, no matter what union you are, if you're an active dues paying union member, this affects you. Because look at us. This is what's happening to us today, and your unions voted for this, and so did you. And you most likely didn't even know that you did this, because it's all in your contracts. So I suggest that you today Google search NYCOLR, New York City Office of Labor Relations. Go into their labor section and look up all the contracts that have been signed, and go back and go through every single one of them. And you will find references to a 2014 and a 2018 agreement. If you have trouble, come to our website, nycretirees.org. I'll make sure that those documents are up there if they're not up there already. You'll be able to see how this thing started, that it started with those agreements. It started with the original UFT contract between the UFT and Labor Relations. And then it went from Labor Relations to the MLC. And then from there to all of you and us. I hope that we are able to stop this. This case is currently in court. We were successfully able to raise money. Our legal fees are astronomical. We have 4 attorneys helping us since August to file this thing. We filed an Article 78 against the city to stop them from doing this. We've received no help from any of our former unions. There's even people this affects that doesn't even have a union. They were managers or commissioners. They had no one to turn to. They came to us. We represent all of them. This will affect over 250,000 retirees and their families. No union to date has expressed support for us. When this went to a vote, there were only 5 organizations that didn't vote to support this. 5. If I could remember them off the top of my head. The PSC, the Sergeants Benevolent Association, the NYPD, the doctors and interns, and the nurses. That's it. So all the others supported it. There technically was, from what we understand, not a roll call vote, so I can't actually tell you that all your unions actually voted for it, but when the votes all came down, it was said that it was widely supported. Because only those 5 spoke out against it. But since I wasn't there, I really can't tell you. It also speaks volumes, as we were understanding that even the District Council 37 Retirees Association president wasn't even allowed in the DC 37 Association vote or the meetings. They were in the same building. He wasn't allowed to be in the meeting. So I wanted you to know that this is happening. I wanted you to know, because more and more this is going to be in the newspaper. You are going to be hearing a lot of things, and I want you to hear it from the retirees, because it affects us, and this is going to affect you. We know what it's like when they first instituted the old HMOs and you had to wait in a clinic on Queens Boulevard in order to wait to see a doctor and hope that you could get seen within the first couple of hours, or before you were so frustrated you decided to walk away. And that's how they save money, because they didn't get to see you. We know what those plans were like. We don't want them. This is what we wanted: our traditional government Medicare plan and a Medigap plan that the city was paying for till our death. And quite honestly, that's what we're entitled to. All of our agreements state that any benefit that we had in retirement, we take into employment, we take into retirement until our death. We had a wide choice of plans. We used to be able to choose from 13 different plans. The city is now giving us a choice of 2 come this year. You will be able to choose to stay in the current plan that you are in, or the Medicare Advantage plan. That's it. New retirees will only be able to choose the GHI Senior Care Plan at a premium of almost $200 a month, or the Medicare Advantage plan, which is free. So you need to know this, and you need to stop your unions from doing it, because this is going to affect you. I don't care if they say it's custom. That's not what we bargained for. That's not what we were promised. So I hope this was a little bit enlightening for you. I'm sorry to have to express this to you, but this has been a very difficult ride for us since this news of this first broke last year. And all of this was done behind our backs. We weren't invited to the table to discuss it. We weren't privy to the information. It broke in the newspaper, and that's how we found out. It came out, I believe, in the Intercept and the New York Focus. And then it went crazy from there. So you'll see advertisements in the Chief, Leader, and in the newspapers, full page ads, and your union, whatever, is all saying how fantastic this is. It's not fantastic. And we couldn't understand this because we trusted our unions. Why would our unions lie to us? It was our family. And you know as well as I know, sometimes your work family is better than your real family, right? Why would you do this to us? We don't understand that. So our case today proceeds. Today we filed the merits of our case in Supreme Court in Manhattan, State Court in Manhattan, and you'll be hearing a lot about it. Our website is nycretirees.org. We have a Facebook page of over 13,000 people that are all retirees that this affects, and that we educate them on a daily basis about the things that are happening. We help them collect the evidence to throw into our case, to help support our arguments, because we are being fed misinformation at just about every turn. As I could show you from all my paper right around my computer, from every different union, someone sending out something about the wrong dates. We have the city and the alliance sending out the wrong booklets, and yet the unions all attacking us. And you know you're onto something when your own union attacks you. So attack the victim because they have no other substance. Or mock us or try to make us sound stupid. We're not stupid. Far from it. We were able to pull this off and get this far, so far, since August. This support that we have is tremendous within the organization, but I will repeat, we have not one union supporting what we are doing. And yet they all want to take credit for the restraining order that we were able to get granted. The UFT and the MLC and DC 37 take credit for a lot of things that we did. It's not true. The only reason they're taking credit for it is because we did it and we made them look bad. So that said, if you have any questions, please reach out to us. We'll be more than happy to answer them. I'll be more than happy to discuss them with you, provide you with any documentation that you need. Have a great night.